It's now time to introduce our special guest. We're happy to have with us tonight Heather Shenkman, MD. Heather Shenkman, MD, FACC, is an interventional cardiologist in practice in the Los Angeles area. While she performs complex angioplasties to open up clogged coronary arteries, she prefers to help her patients reduce their risk of heart disease through a healthy lifestyle, including a plant-based diet and regular exercise, in addition to medication when appropriate. She is an avid athlete, having completed over 100 events of various distances, from sprint triathlons to Ironman distance triathlons, marathons and ultramarathons, and several 100-mile century cycling events. Wow, this is really impressive. Dr. Shenkman is a strong believer in a plant-based diet for heart health, as numerous studies have demonstrated prevention and even reversal of coronary artery disease. She has written the just published The Vegan Heart Doctor's Guide to Reversing Heart Disease, Losing Weight, and Reclaiming Your Life. Her website is drheathershenkman.com, and she can be followed on Twitter at veganheartdoc. Her presentation tonight is the same name as her book, which is The Vegan Heart Doctor's Guide to Reversing Heart Disease, Losing Weight, and Reclaiming Your Health. Please join me in welcoming Dr. Heather Shenkman.
Lauren, thank you kindly for that introduction, and thank you to the Vegetarian Society of Hawaii for inviting me to speak to you. I'm going to talk a little bit about plant-based diet and heart health. So what you're going to learn today, you'll learn what coronary artery disease is. You'll learn how a plant-based diet can prevent and reverse heart disease. You'll learn what high blood pressure or hypertension is and how it can be treated with lifestyle, and how, if you're not already adopting a plant-based diet, how you can do it and how it's not that hard. So a little bit about me. I am an interventional cardiologist. I've been in practice for about 11 years since finishing training. Up here I've got a picture of me and my staff. That's my front desk person, Sylvia, my medical assistant, Diane, and my sonographer, Ramin. In addition to working as a cardiologist, I have been a triathlete. I've completed 2 Ironman distance triathlons. I've done probably close to 100 races of various distance over the course of perhaps 10 years. And I like to take what I've done and learned as an athlete and incorporate that into what I do as a cardiologist. And as a cardiologist, I am trained in what's called interventional cardiology. In other words, I have done additional training such that I can feed catheters into the heart and open up blocked arteries and literally save a life of somebody if they're having a heart attack. But what I would prefer to do is I'd like to reach people before they get to that point, and I'd like to keep their hearts healthy for years to come. Based on that, I wrote a book, and it took me about 7 years to write this book. It's The Vegan Heart Doctor's Guide to Reversing Heart Disease, Losing Weight, and Reclaiming Your Life. And in this book, I've tried to convey what I'd like to convey to my patients so that they know about heart disease and they know about what things they can and should be doing so that they can keep their heart healthy for years to come. Let's start by talking about what a plant-based diet is. So a plant-based diet, what is in it? We'll start with what is in it. Vegetables, grains, beans, fruits, nuts, and seeds. What's not in it is animal products. Processed foods in a plant-based diet are minimal. And I make the distinction between vegan and plant-based. A vegan diet has no animal products, but it's not necessarily the healthiest of diets. For example, you could have a bottle of Coca-Cola and a bag of potato chips and a container of red vines, and you'd be eating a vegan meal. But I think we can all agree that that's not a terribly healthy meal. So a whole food plant-based diet is a vegan diet that is mostly unprocessed. And the reason why is that studies have shown that diets that are more plant-based have lower risks of many different kinds of diseases, including heart disease, which I treat, high blood pressure, which I also treat, type 2 diabetes, intestinal issues, several kinds of cancers, osteoporosis, kidney stones, and gallstones. Over time, unfortunately, with the standard American diet, we have, in general as a society, have gotten heavier, and that's much due to what we eat, and much of what we don't eat, like not eating enough fruits or vegetables, and how much we move or don't move. So I've got a couple of maps here that show you trends of obesity. And if we look back at 1991, you'll see that most places are about 10 to 14% obese. A couple of heavier places like Michigan, where I'm from, West Virginia, and some of the South, you've got a little bit more obesity at 15 to 19%. We see more of those dark blues in 1996. In 2003, we see some brand new yellow and orange colors representing more obesity. 2010, we've got several places that are over 30% obese. And then we skip to the most recent map from 2016, which needed a whole new color scheme to demonstrate how much obesity there is. So you can see that there are places in the country where more than 35%, so well over a third of people are obese, in the Deep South and in West Virginia. Where I'm from, California, about 25 to 30% obesity, which is on the lower end of the range. In Hawaii, you guys are, in general, according to this, pretty svelte compared to the rest of the country. Now, the American diet, unfortunately, what people eat, is leading us to having many of the diseases that we have and carrying the amount of weight that we often carry. Unfortunately, more than half of our diet, and when I say our, I speak of the standard American diet, about 51% of what is consumed is refined and processed foods. 42% is dairy and animal foods, and a very, very sad and low 7% of what is consumed is fruits and vegetables. That's kind of sad. Dr. Campbell's China study, it was a study of the populations of China, particularly the rural populations of China, where the diet tended to be more plant-based compared to the more industrial portions of China where diets were becoming more Western, where we were seeing more fast food, more animal products. And he looked at comparing those populations that were more traditional plant-based to those that were more modern with the more westernized diet, and found that those populations that ate closest to their traditional way of eating, which was more plant-based, had less of the diseases that we see in the Western world, like heart disease, high blood pressure, diabetes, and several kinds of cancers. And a quote that I like from him is, "The vast majority of all cancers, cardiovascular disease, and other forms of degenerative illness can be prevented simply by adopting a plant-based diet." So what is coronary artery disease? And I like to talk about what heart disease is before I talk about how you can prevent it, because it's important to know what you're dealing with. So coronary artery disease is plaque within the arteries of the heart. Now, the arteries of our body supply nutrients, they supply oxygen, they supply blood to our organs and our muscles, but we also need arteries to supply nutrients to our heart muscle. Our heart is a muscle, after all. And when we talk about coronary artery disease, we're talking about these little red things that run along the surface of the heart. And this is what we call plaque, which is buildup of cholesterol and other particles within the wall of the artery. And over time, what can happen is that this can become narrow enough such that it's hard for blood to get to part of the heart muscle. It also can rupture and can cause a heart attack. So the risk factors for coronary artery disease, and we've talked a little bit about this already. There are some things we can change, and there are some things that we cannot change. The things we cannot change in particular are genetics. Unfortunately, if you're born with bad genes, you're going to be somebody who's going to be more likely to develop heart disease. Also, gender. Men tend to have more heart disease, particularly at younger ages than women. However, as women reach menopause, the difference between an incidence of heart disease between men and women, it gets smaller. But what's important is that there are so many things that you can modify, that you can change. I know a lot of people will come to me, they'll say, well, you know, my dad had a heart attack at 40, so I'm destined to have that happen to me. And that's not true at all. The best phrase that I've heard is genetics loads the gun, lifestyle pulls the trigger. So the things that you do with your lifestyle are very, very important in reducing your risk of potentially having heart disease. The things that are modifiable. Number one, the biggest thing that you can do if you're a smoker, quit smoking. Smokers on average will shorten their life by about 8 years. So smoking's a big deal. It increases the risk of heart disease, increases the risk of lung cancer. Many other health issues come of smoking. Diet, what you eat. A whole food plant-based diet is very, very good for heart health, and it's the one diet that's been demonstrated to reverse heart disease. No other diet has done it. I have patients who come to talk to me about, well, I eat fish and chicken. Well, fish and chicken have never been demonstrated to reverse heart disease. Exercise, how much you move, whether you do move, is very, very important. The guidelines that were given from the USDA is that we're told to say, move 30 minutes 5 days a week. But really, ideally, it's probably better to move an hour, 60 minutes 5 days a week. And how you break that up is up to you. If you want to go for a couple of long hikes on the weekend, that's pretty good if you don't move as much during the week. But moving and exercise is very important. Blood pressure, controlling your blood pressure. If you have high blood pressure, making sure that it's controlled is very important. Knowing what your cholesterol profile is. If your cholesterol is abnormal, knowing the things that you need to do to treat it, which in some cases may involve cholesterol medications. Diabetes. First of all, preventing diabetes. A whole food plant-based diet is excellent at reducing the risk of developing diabetes in the first place, but if you are a diabetic, it is something that you want to make sure that is treated. Stress. Managing stress is actually very important in reducing your risk of heart disease. There's actually something called a stress-induced heart attack. This is something that is real. It's also called a Takotsubo cardiomyopathy. It's more common amongst women, and what can happen is in the setting of having a very stressful or traumatic event, the heart can suddenly become weak and can leak off heart muscles, and it is a uncommon type of heart attack, but it can happen. I can recall, for example, one woman who had a horrible argument with her boyfriend and broke up with him, ended up having one of these heart attacks. And she's a woman I treated actually fairly recently. Now, diet is important. Societies and countries where more vegetables are consumed have less incidence of heart disease and cancer. So we start here to the furthest on the left, Hungary and the United States, that have the least amount of vegetable consumption. They have the most amount of heart disease and cancer as a percentage of deaths, whereas you look at countries on the further right, like Korea, Thailand, and Laos, which have more calories consumed from fruits and vegetables and have less incidence of those diseases. Have any of you heard of the blue zones? So blue zones are areas of the world where people tend to live the longest and live the best and healthiest, and where people reaching their 100th birthday is not that uncommon. One of those places is in the United States. It's Loma Linda, California. There are other locations like Nicoya, Costa Rica, Sardinia, Italy, Ikaria, Greece, and Okinawa, Japan. And these places have a number of things in common. They tend to have more family connections. They tend to smoke less. Their diets tend to be more vegetarian. They eat more beans. They have constant or often are physically active, and they're engaged with one another socially. Now, one of those places in particular is Okinawa, and this is a great picture that demonstrates what the Okinawans eat. 70% of their diet is actually sweet potatoes. And a lot of people will think, but that's Japan, don't they eat a lot of fish? But if you look at the traditional Okinawan diet, it's actually a 96% vegan diet. They actually consume only 1% of their diet from fish. About 1% from dairy, 1% from eggs, 1% from pork and meat. So it is a mostly vegetarian diet. I like this picture because this is Dr. Kim Williams. He is the former head of or president of the American College of Cardiology, which is our really governing body as cardiologists. And he is a longtime vegan. I think he went vegan in the early 2000s, and I love this phrase that he has. There are two kinds of cardiologists, vegans and those who haven't read the data. And I think that to me makes a lot of sense. And I'm going to tell you why. I'm going to talk a little bit about why a vegan diet is so good for the heart. And we've got a couple of studies to support this. So the first study that I'm going to talk about is Dr. Dean Ornish. And he had what is a lifestyle program. It wasn't just diet, but one part of it was a low-fat vegetarian diet. The program also consisted of moderate exercise, managing your stress, quitting smoking, and group support. The diet was a vegetarian diet. It was a mostly vegan diet. So it had plenty of fruits, vegetables, grains, legumes, and soy. People could eat as much as they want until they were satiated. Less than 10% of calories naturally from the diet came from fat. There were no animal products that were allowed, except for, they actually did allow for egg whites and a cup per day of non-fat milk or yogurt. There was no caffeine and very limited amounts of alcohol. Now, he had two groups. One was a control group, which was basically told you can do what you want. They were given standard advice, fish and chicken, and go out and get some exercise, and smoking is bad. Whereas the experimental group, they were pretty extensively counseled. They had group meditation sessions, group support sessions. They were educated very diligently about what to eat, what not to eat. They were encouraged in their exercise. So the experimental group, those patients who followed the Ornish lifestyle program, they actually had reversal of the plaque buildup within their arteries. And reversal is a pretty big deal because the natural history of coronary artery disease is plaque builds up within the arteries, and it continues to build up more and more and more over the years. So it's very uncommon where we see something that actually reverses that trend, and his diet actually did. Whereas in those who followed what would be considered to be standard advice, they actually had progression or continued buildup of plaque in the arteries of the heart, which we expect. The people who were on the Ornish lifestyle program had a decrease in how much angina they had by 91%. So that heart-related chest pain or angina almost entirely went away, whereas in the control group, the amount of angina actually increased pretty significantly. Of those patients who were on the Ornish lifestyle program, 82% of them actually had regression or reversal of the narrowings of their arteries. So it was a pretty big difference between those two groups. I'm going to talk next about Dr. Caldwell Esselstyn. Dr. Caldwell Esselstyn actually is a breast surgeon from the Cleveland Clinic. He is not a cardiologist, but he is somebody who has a father who passed away of heart disease in his 40s, and he was inspired to see if heart disease could be reversed with diet as well. So he actually took on some pretty sick people, and people who were even significantly sicker than Dr. Ornish's studies. So he took on people who had severe 3-vessel coronary artery disease. And some of these people had been told, you really don't have that much to live, we don't have anything more we can do for you. And he put them on a strict vegetarian diet. So similar to what Dr. Ornish did, but a little bit more strict, and we'll talk a little bit about that. It wasn't a big trial. He recruited 21 patients to do this, and of those, 17 followed the diet, and we've got data on 11 of them who were followed for many years afterwards. So what was allowed on his diet? He allowed grains, legumes, lentils, vegetables, and fruit. What was not allowed was animal products. He did not allow nuts, oil, seeds, or avocado. So this was a very strict whole food plant-based diet. Now the people who were in the study, like I said, they were pretty sick. Of the 11 patients who were followed out for a long period of time, there were a total of 37 events that had occurred in the 8 years before this trial had begun. So of those 11 patients, there had been 15 episodes of increased angina or heart-related chest pain. There were 6 cases of these 11 patients who had been told that they had progression of their disease. 6 of them over those 8 years prior to the study had undergone bypass surgery, and actually there were an additional 2 more who had had bypass surgery even before those 8 years before the study. 4 patients had heart attacks, 3 patients had strokes, 2 had angioplasties, and 1 had a worsening stress test. So these were pretty sick people that had a lot of things happen to their heart. However, after 5 years after the study, these patients were followed. There were no events, nothing happened to these folks bad to their heart. None of them had heart attacks, none of them had strokes, none of them needed to have another surgery on their heart or an angioplasty. So it was pretty dramatic results from this whole food, fairly strict whole food plant-based diet. And this is Dr. Caldwell Esselstyn. He's the author of this study talking about the results, because I encounter this every day. Going on a vegan diet, that sounds like that's horrible, that's such a dramatic thing to do. I don't think I can do that. And Dr. Esselstyn's response to that is, some people think that a plant-based whole foods diet is extreme. 500,000 a year will have their chests open up and a vein taken from their leg and sewn onto their coronary artery. Some people would call that extreme, which, if you put it into perspective, makes a lot of sense. Now, Dr. Esselstyn actually took his study to a larger population. His initial research really only reflected 21 patients that he recruited. He then looked at a total of 198 patients who he recruited, and he followed them out for anywhere up to 13 years to see how they did. And similarly, they underwent intensive counseling. They were about how to eat. They were on whole food plant-based diets without nuts, without avocados, without seeds, and no oil. Of those 198 patients, 177 or 89% of them actually were able to stick with the diet. And patients were followed for, like I said, up to 13 years. And these folks actually who stuck with the diet did well. And again, almost 90% of these folks stuck with what would be considered a fairly strict plant-based diet. There were a total of 4 events in the 177 people who stuck with the diet. There was 1 stroke, 2 bypass surgeries, 1 person needed to be stented again in one of their arteries. Whereas those who did not stick with the diet, those people were followed as well. And of the 21 patients who did not stick with the diet, 11 of them had events. 2 strokes, 4 angioplasties, 3 bypass surgeries, 1 surgery on an artery of the body, and then 1 heart transplant. So pretty significant difference. And angina, those patients who stuck with the diet, most of them had an improvement in their angina or heart-related chest pain, whereas those who were not adherent to the diet, more of them had worsening of their heart-related chest pain. So the bottom line of this study is that when you have a larger group of people follow a whole food plant-based diet that is free of nuts, avocados, seeds, oils, you actually can have good results. It wasn't just this one small study. This is something that can be applicable to a larger population of patients. Now, this here is a PET scan that was done on one of the patients in that study. In a PET scan, it's a nuclear study that looks at where isotopes will go. And if you look at the first picture on top, you'll see that there's where that arrow is. There's an area that's essentially black. And that is an area of the heart that's not getting a lot of blood flow. And if you look at the picture below, that is 3 weeks on a plant-based diet. You can see that area of the heart that was black is now colored, and that is reflecting that there is blood flow to that part of the heart. So the bottom line is that even after a few weeks, you can see improvement of heart disease on a whole food plant-based diet. I talked to you a little bit about President Bill Clinton. He underwent bypass surgery in 2004. If you may recall, he was somebody who was famous for his bad eating habits, his love of McDonald's, and unfortunately he developed coronary artery disease and had bypass surgery. He then underwent an angioplasty in 2010 to open up one of those veins. After that, he became interested in what he could do so that this wouldn't happen to him again, so that he could keep his heart healthy. And he came upon the studies that I just talked to you about from Dr. Dean Ornish and Dr. Caldwell Esselstyn, and he himself decided to adopt a whole food plant-based diet. You may recall a couple of years ago, Bill Clinton actually lost, I think, 24 pounds. And I believe that it's a weight loss that he has maintained since then. And just to show to you that this is somebody who was not, this is not somebody who was inclined to eating healthy, and he is somebody who is able to follow a whole food plant-based diet. Now I'm going to switch gears now. I'm going to talk to you a little bit about hypertension or high blood pressure. High blood pressure is a risk factor for heart disease, and it's something that's important to control. So high blood pressure or hypertension is now currently referred to as a blood pressure of over 130/80, and that's fairly new. You may recall being told in the past 140/90 was the threshold for blood pressure, but recent research has led the physicians who write the guidelines that we follow to classify high blood pressure as actually being at a lower cutoff, which means that the number of people in our country who have high blood pressure has increased to about half of all Americans. High blood pressure is referred to as the silent killer because you may have high blood pressure, but you're not necessarily going to feel it, and most people with high blood pressure don't feel it. Blood pressure, it is a measure of the pressure in your arteries as blood passes through. The systolic number is the top number, and that is the highest pressure that your arteries are under. Those are when the heart squeezes blood out to the body, and that is the highest pressure that your arteries will feel. The diastolic blood pressure is the lower number, and it is the lowest pressure between heartbeats. So it is when the heart is relaxed and there is not blood rushing through the artery. So as a result, the blood pressure is something that fluctuates over the course of the cycle of the heart. High blood pressure is important because there are a number of consequences of high blood pressure. People with high blood pressure are at an increased risk of stroke. They're at an increased risk of losing their vision. They are at increased risk of congestive heart failure and heart attacks. They're at increased risk of kidney problems and requiring dialysis, and they're also at risk of having issues with their sexual function, in particular impotence in men. This is from the American Heart Association, and this is part of their campaign to make people aware of the importance of high blood pressure and getting blood pressure under control. This is a woman who actually suffered a stroke, and you actually can see that she has limpness of one of her arms, and she has a droop of her face. This is another picture from that campaign, and this is a man who actually had a heart attack, and you can see he's showing the scar on his chest from the bypass surgery that he underwent. And much of his issues he had with his heart attack were as a result of having blood pressure that was not controlled. So the risk factors for high blood pressure. Smoking absolutely is a risk factor. Diabetes, a family history. If you have parents or siblings who are diagnosed with heart disease or high blood pressure at a young age, you are at increased risk of developing high blood pressure at a younger age. High cholesterol, age. The older you are, the higher your blood pressure will tend to be. Your weight, heavier people tend to have higher blood pressures than those who are of a normal weight. Not being active, so if you have a sedentary lifestyle, you're more likely to have high blood pressure. Salt in the diet, so a high sodium diet will lead to an increased risk of high blood pressure. Alcohol, excessive alcohol intake will raise blood pressure, and stress, emotional stress, will increase the blood pressure and increase the risk of hypertension. So how is a blood pressure taken? Blood pressure is taken with a cuff, and I'm sure just about everybody in this room has had their blood pressure taken. That cuff is wrapped around your arm, and there's a and if it's being done manually, there's a stethoscope that is here on the arm. The cuff is inflated, and it is inflated to a higher number than we anticipate the blood pressure to be, and then it is slowly deflated. And the point at which we start hearing a noise, which is the turbulent blood flow, that is the systolic, that is the top number of the blood pressure. And then we gradually continue to deflate that cuff, and then when the noise stops, that is the diastolic blood pressure, because we're no longer compressing the artery, so we're not hearing turbulent blood flow. You can take a blood pressure even at home with a cuff. There are automated devices that are either for the wrist or they're for the upper arm. You put it on, you push a button, and it will inflate and check your blood pressure. There are frequent blood pressure machines in various drugstores and grocery stores as well, and also, of course, at your doctor's office. Now, how to get an accurate blood pressure reading, and I see blood pressures being taken wrong, even in doctor's offices. I've been a patient, and I've been told, oh, hop up on the table, we're gonna check your blood pressure, and it's like something inside of me just dies, because that's just the wrong way to check a blood pressure. Blood pressure should be checked when a patient or a person is sitting in a chair, like the chairs you're all sitting in, with your back being supported, your feet uncrossed, they're flat on the floor, the arm is resting about at heart level, so perhaps if I were sitting, it would be about right here. Empty bladder, so don't have to go to the bathroom, and of course not talking. A person should also have been sitting calmly and quietly for a couple of minutes before the blood pressure is taken also, in order to get an accurate blood pressure. If a blood pressure is taken inaccurately, like if a patient is sitting on one of those examination tables, their back not supported, their feet dangling, they're chit-chatting with the medical assistant, the blood pressure can be up to 14, the systolic blood pressure can be up to 14 points higher. So taking a proper blood pressure is actually very important. Now, as I mentioned, the categories of blood pressure have actually changed very recently. We used to call 140/90 the threshold for high blood pressure, and based on the results of a number of recent studies, that threshold has changed. So what is being called a normal blood pressure is anything that is really under 120/80. We're calling 120 to 129 over as a systolic blood pressure as being an elevated. That's not hypertension, but that is an elevated blood pressure, because it is in somebody who naturally and normally has a blood pressure under 120/80, that is really the threshold under which you have the lowest risk of developing a heart attack or a stroke. So stage 1 high blood pressure is now 130 to 139 is the systolic, or the top number, and 80 to 89 is the diastolic, or the lower number. High blood pressure stage 2 is now 140 as the systolic or higher, and 90 or higher. And a hypertensive crisis, according to the slide, we say a systolic blood pressure of over 180 and a diastolic over 120. I've seen people who are walking around and feeling fantastic with blood pressures that are like 210 over 120. That's just how they live, and unfortunately, that's how they feel well. And unfortunately, that's somebody who's going to be at very high risk of heart attack or stroke. That said, anybody who has significant symptoms with a very high blood pressure, who has a severe headache as a result of a very high blood pressure, or vision loss, or sudden weakness or numbness as a result of an elevated blood pressure, that's also a hypertensive crisis or emergency. Now, white coat hypertension is something that I think is important to talk about, because there are a lot of people, and it's about 30% of the population, who actually have a significantly higher blood pressure when they go to the doctor's office. So these are people who, if you were to check their blood pressure at home or at the drugstore, their blood pressure would be nice and normal. But when they go to the office and they're in the doctor's office, there's something inside their body, something that drives their system. Perhaps it's nerves or anxiety, and their blood pressure will actually be significantly higher. So it's important that before you accept a diagnosis of hypertension, you make sure, if you're a patient, you make sure that your blood pressures truly are hypertensive outside of the doctor's office, and that they're not just high in the doctor's office. And that's something that I follow as well as a doctor. If I see somebody who's got high blood pressures in my office, I'll send them home and say, look, I want you, we're going to talk about lifestyle. First of all, I'll talk about eating well, whole food, plant-based diet, regular exercise, staying away from things that are high in sodium, minimizing restaurant meals. But we'll also talk about checking blood pressure at home and coming back in a few weeks with a list of those blood pressures. And if those blood pressures at home are good, then I'll say, well, you probably don't have hypertension at this point, but we keep an eye on you. But if those readings correlate with what I see in my office, the blood pressure is high at home as well, then that's somebody who I'm going to talk to a little bit more about treatment of blood pressure, potentially with medications. However, when it comes to high blood pressure, and this is something that's emphasized in the new guidelines that we have, even though those thresholds are lower, the emphasis is we don't just throw pills at people. You don't come to the office and have a blood pressure of 130/80 and walk out the door with a prescription. That is not the way to do things. The way to do things is to address lifestyle first and foremost. Make sure that somebody is consuming a low sodium diet, which would be less than 2,300 milligrams per day. Make sure that they are exercising as they should be. Weight is controlled. If somebody is carrying extra weight and they have a high blood pressure, we're going to talk about weight loss to help to lower that blood pressure. We'll talk about diet choices, so eating more fruits, more vegetables, whole grains, nuts, legumes, more whole food, plant-based. We'll talk about cutting back on things that are not good in the diet, like sweets, sugary beverages, red meat, saturated and trans fats. We'll talk about quitting smoking, because smoking absolutely raises the blood pressure. And we'll talk about minimizing alcohol, because a lot of people who have these high blood pressures and that we can't get under control, often we'll find out that they're significant drinkers, and that hasn't been something that's been revealed to us. But cutting back on alcohol in somebody who's a heavy drinker, or cutting out alcohol completely, is very, very potent in helping to control the blood pressure. Now, I show you this quick slide. This is a research paper from 1929. It's a little bit old. And the point behind this is looking at blood pressures in rural China compared to blood pressures in people in North America and Europe. And you'll see that the blood pressures in rural China, those are on the left, they tend to drop as people get older. So those who are 15 to 19 years old have a systolic blood pressure of about 123, and then as they get older, the blood pressure actually gets a little bit lower. However, in the Europeans and Americans, that blood pressure actually goes up with age, and it's perhaps very much a function of lifestyle and of diet. I also show you this study that demonstrates that vegetarians actually tend to have lower blood pressures. So the bars that I've circled are the systolic and diastolic blood pressures of vegetarians, and the ones that are not circled, those are the blood pressures of people who are following a standard American diet. So a vegetarian diet absolutely has a role in lowering blood pressure, and people who tend to be vegetarian have a lower risk of developing elevated blood pressure over time. I'm going to talk to you about the first diet that was used to control high blood pressure, because back in the 1940s, we didn't have blood pressure medications. We just measured blood pressures and we saw that they were high, and we knew that was really not a good thing. Dr. Walter Kempner came up with a diet to treat high blood pressure. And that diet actually sounds pretty draconian. It's a diet of white rice, fruit, juice, and sugar. And that was it to start with. And most patients actually saw incredible drops in their blood pressure. They also lost a whole lot of weight on this plan as well. Their cholesterols dropped, if they had enlarged hearts from having high blood pressure, the heart size decreased, and many of them who actually had eye damage or retinopathy from elevated blood pressure had a reduction of that. So what's in a rice diet? It was a diet that consisted almost entirely of rice and fruit. So it actually was a vegan diet, not a very palatable vegan diet. It had a total of about 4 to 5% of calories from protein, had 2 to 3% of calories from fat, and a very, very low amount, 150 milligrams of sodium. And these people were encouraged to exercise. And you can see that there's a very, very big difference between Dr. Kempner's diet and the standard American diet. Now, this is the blood pressure of one of the subjects. So this particular subject started with a blood pressure that was about 200 over 120. And as he started on the diet, you see that both blood pressures come down. I think that he had a tomato added at some point, and then he had a little bit of meat added to the diet. But this is somebody who was treated with Dr. Kempner's rice diet and got his blood pressure from a very high level down to normal without medications, because again, medications at this time did not exist. These are a couple of the subjects who were treated by Dr. Kempner's diet for blood pressure. And you can see that there's definitely a very big difference in their body size before and after the diet. Now, Dr. Kempner's work was perhaps some of the inspiration for dietary advice, and particularly the DASH eating plan, which I think many of you may be familiar with. The DASH diet is the diet to stop hypertension, and it encourages grains, vegetables, fruits. It also includes small amounts of meat and nuts, seeds, beans, a little bit of fats, a little bit of sweets. The question is, if we know that, or we think that animal products are raising blood pressure, why would we include them in the diet? And this is the paper that introduced the DASH diet, and I take this quote from it. It said the diet design goals were to create patterns that would have the blood pressure lowering benefits of a vegetarian diet, yet contain enough animal products to make them palatable to non-vegetarians, which is kind of a cop-out in my opinion. You know, if you think that the vegetarian diet is what's going to get you the highest blood pressure, that really is what should be recommended. Now, there are alternative treatments to high blood pressure, and these are some things that you can do that can actually naturally lower your blood pressure. Yoga, people who can do yoga 2 to 3 times a week, you can actually get about a 7-point systolic blood pressure drop, and I believe a 4-point diastolic blood pressure drop. So yoga definitely does lower blood pressure. Tai Chi, Qigong, meditation, all of these are effective in lowering blood pressure. There are a few supplements that have been demonstrated to reduce blood pressure a little bit as well. Coenzyme Q10 is one of them. Omega-3 fatty acids at fairly high doses of about 3 grams per day. L-arginine, hibiscus tea, and even ground flax seeds can lower the blood pressure. But that said, if with these conservative measures the blood pressure is not controlled, then perhaps the next step is going to be medication. With using medicines to treat high blood pressure, typically the way to go about this is to start with one blood pressure medicine or a pill that has a combination of 2, and often I would choose a combination pill that has 2 medicines in it because with blood pressure, it's easier to control blood pressure with 2 different medications. They have 2 mechanisms that work differently from one another. It's fairly rare that somebody who's on medicine for blood pressure, that just one medicine will cut it, unfortunately. Gradually, I will bring somebody back and increase the medications if needed to get their blood pressure under good control. When I put somebody on a blood pressure medication, I tell them this is not something that's necessarily for the rest of your life. This is something that is fluid, that can change. So, for example, if somebody with high blood pressure who's obese loses 50 pounds, often they reverse their high blood pressure. Or if they manage to change their eating, they've managed to get onto a whole food plant-based diet, that can certainly lower the blood pressure, and that's somebody who I might at some point take off those blood pressure medications. There are some patients who are not compliant with their medications, and they may feel that the medicines are to be taken as needed. So I checked my blood pressure, it was a little bit high, so I took my pill, and then I checked my blood pressure the next day and it was good, so I didn't take my medicine. And that is certainly not an effective way to control blood pressure with medications. We use the goal of 130/80 as a goal for blood pressure in most people. And I emphasize most because this is not something that is set in stone. And if somebody who is very elderly and is frail, there is risk of lowering the blood pressure too low. And that is somebody who may need more pressure to the brain. They may have an increased risk of falls if you get their blood pressure down too low. So there are some populations who we're a little bit more cautious with when we talk about lowering blood pressure. If I'm dealing with a patient whose blood pressure is not controlled, there's always a lot of reasons why that might be. And the first reason might be they're not taking their medications. Any time somebody comes into my office, I make sure that I have an accurate list. When I ask, what are you taking? The answer of, well, doc, you have it in your record, is the wrong answer, because people will forget to take things. They'll accidentally get a prescription from another doctor. The pharmacy may fail to dispense a medication. So I always like to make sure that my patient is taking what I think they actually are taking, not taking medications properly. So there are some medications that are meant to be taken twice a day. If it's only being taken once a day, it's not going to be effective. Diet, that's a big one as well. If somebody is on 4 blood pressure medications and their blood pressure is still high, and yet they're eating half their meals from McDonald's and the other half from Burger King, the blood pressure may not be controlled because they're getting a lot of sodium in their diet, and that's somebody who we need to talk about eating better. Pain, anxiety, stress, these all drive the blood pressure up. Sleep apnea. Sleep apnea is a condition that's more common in people who are heavier, but it can happen in people of any size, and it's a condition in which you really stop breathing at night, and then what will happen is that the oxygen level within the body will drop dangerously low, and that causes high blood pressure. It causes changes to the arteries. It increases the risk of arrhythmia. So it's definitely a condition that should be treated. So if you have somebody who snores loudly, and then they suddenly stop breathing for several seconds, and then all of a sudden they breathe really loudly and start breathing really fast, that's somebody who has a good chance of having sleep apnea and needs to talk to their doctor about being tested for it and potentially treated. Alcohol, as we talked about, alcohol definitely drives the blood pressure up, so cutting back on alcohol will help to improve blood pressure control. Weight gain, if somebody's been on a couple of medicines for blood pressure and suddenly their blood pressure is uncontrolled, it could be related to a recent significant weight gain, which will drive the blood pressure up. And then my favorite is overzealous blood pressure checking. I have people who come into my office who have like pages and pages of blood pressure readings from like 3 days because they check their blood pressure 10 to 12 times or more in a day. I've seen this, and I think that just kind of drives anxiety and makes them more upset and drives the blood pressure up. I really ask my patients to check their blood pressure really just a couple of times a week. Check it first thing in the morning, after you go to the bathroom, before you eat anything, before you drink your coffee, if you smoke, before you pick up a cigarette. Just check your blood pressure first thing in the morning. Next, I'm going to talk a little bit about plant-based choices. There are lots and lots of plant-based choices. I think that when we talk about going vegetarian or going vegan, it sounds like, to many people, it sounds like it's very restrictive, and it's really not, because I like to think of it as you're not just taking things out of the diet, you're adding things in that you may not have eaten before. So how to transition to a plant-based diet. And I talk to my patients about this every day, because quite honestly, in my practice, the vast majority of patients who come to see me are not vegans. There are a number of people who do seek me out because they know that I happen to be vegan, but I talk to a lot of people who are, shall we say, veg curious, or often not veg curious at all. And I try to encourage them to eat a whole food plant-based diet. So I start by saying, well, what do you actually eat that is vegan? Because I think that people don't realize it, but they probably do have a few meals in their repertoire that, without even thinking too hard about it, happen to be vegan meals. So for example, a spaghetti with tomato sauce, or a vegetable stew, or a tofu and vegetable stir fry, something very basic that's already vegan that a lot of people already eat and just don't think about it that way. Then think about a couple of meals, like what do you eat that you could veganize or make vegan? So let's say you like pizza. You could get a pizza that is loaded with vegetables. It might have some tofu on it. If you wanted a somewhat more decadent vegan pizza, you could get some vegan cheese on it. That's one meal that could be veganized. Or a vegetable stew, or a chili, maybe a chili that has ground beef in it. Well, you can pull the ground beef out of it and add some more beans or lentils, and you can still have a delicious vegan chili. There are lots of resources out there. There are tons of cookbooks. There are tons of online things. You can go to a Google search engine and type in like vegan macaroni and cheese, and you'll get like thousands of recipes for vegan macaroni and cheese. And there's so much out there. And at the end of my talk, I'm going to put up a slide that's got a couple of really good resources for recipes if you want to look online. Changing your diet gradually. That's one way to go about things. I know people who overnight will say, I'm going to go vegan, or I'm going to go plant-based, and they just do it. And kudos to them. For some of us, it's a little bit more difficult. I know when I decided that I was going to follow a vegan diet, it honestly took me about 1.5 years from thinking about, I know I want to do this, to actually doing it. So what some people might do, one approach might be to eliminate one food at a time. Maybe you'll start with dairy and say, I'm going to take dairy out of my diet, but then what am I going to replace it with? There are many kinds of non-dairy milks. You go to the grocery store, even the simplest of grocery stores is going to have soy milk or almond milk, and there's some fancier milks out there too, like cashew milk, hemp milk, rice milk, and so forth. Cheese, we're often used to having cheese in a sandwich or on a pizza. And in a sandwich, you can really replace the cheese with something like an avocado or hummus if you want that creamy texture for your sandwich. Or there are the store-bought vegan cheeses, which are not necessarily the perfect nutritional choice, but they don't have dairy in them. Meat, taking meat out of your diet. So instead of relying on that meat product being the protein block of your meal, think of other things that can serve that role. So things like beans, lentils, tofu, seitan, which is a form of wheat gluten, which kind of has that meaty texture to it. I don't specifically say veggie burgers or fake mock meats. Those, I think, are reasonable, what I would call transition foods. So if you're transitioning to a whole food plant-based diet and you're used to eating like a hamburger, maybe adding a veggie burger in place of that item might be good for a while. But that said, the ideal for a whole food plant-based diet is to lean away from processed foods like these mock meats, which do tend to have a little bit more sodium or salt and many, many ingredients in them. Another way to transition to a whole food plant-based diet is to start by eating one plant-based meal per week. There's this trend called Meatless Monday, where some places will serve meals that don't have any meat. And that's one way to go. I put this slide in here as I gave this talk at a hospital, and they wanted me to make sure that people were aware there are lots of plant-based ethnic options. Middle Eastern restaurants are definitely a go-to for me because there's lots of options there. There's the hummus, there's tabbouleh salads, there are eggplant salads. There's falafel, which isn't the healthiest of choices because it is fried, but it is vegan. Japanese food, any sushi restaurant you can get edamame, you can get a sushi roll made with tofu or vegetables. Miso soup you have to be careful with in a mainstream sushi restaurant because the vast majority of those are made with a fish broth. Indian food is definitely a good choice for eating vegan. There are dishes like chole, which is made from garbanzo beans, or dal, which is a lentil dish. You do have to be a little bit careful because a lot of Indian recipes will include ghee, which is a clarified butter, or paneer, which is a type of cheese. Filipino, I include that because actually in Southern California I do have a fair number of Filipino patients, and there is actually a website called veganpinoy.com. The Filipino diet, at least from my experience with my patients, tends to have a lot of white rice and a lot of fried meat, a lot of fried pork, and not necessarily a lot of vegetables. But there certainly are, at least on this website, there are definitely options for eating traditional Filipino dishes in a manner that is plant-based, and one of them is something called bolongalang, and I hope I didn't butcher the pronunciation of that, which is a boiled mixed vegetable dish. Mexican food. Now, if you go to a traditional Mexican restaurant, you have to be careful because yes, there are beans, but those beans tend to be fried in lard, which is definitely not a healthy choice, and that lard is an animal product that is certainly not healthy for us. But a simple Mexican meal can be a taco, like a corn or flour tortilla with beans, black beans or pinto beans, with salsa and guacamole. If I go out to dinner and I'm for some reason going to a Mexican restaurant, what I'll typically get is, if they don't really have good vegan options. I'll look at the menu, I'll find what looks like the heartiest salad, I'll get that salad, I'll substitute out the chicken for some black beans, making sure, of course, they're not fried in something that is an animal product, and then I'll get all the vegetables I can, and then a side of guacamole and some pico de gallo to put on top of it. And for me, that's a delicious meal. I enjoy that. Or a veggie fajita, some grilled vegetables and some tortillas is also delicious. Chinese food, there are lots of options. For example, a tofu stir fry is one of many options. There are lots of vegetable options in Chinese food or even at a Chinese restaurant. So the side effects of a vegan diet. So when somebody initially transitions to a whole food, plant-based vegan diet, you may not feel great because your body is getting used to eating differently. So in the short term, you may feel gas or bloating, and that's because you're probably getting more fiber than your body's used to getting, and your intestines really need to become more accustomed to fiber. You may feel cramping or constipation or even diarrhea and headaches, but in the long term, really, I think most people that I've spoken with, and I can speak from my own experience, switching to a plant-based diet, you feel better, fewer ups and downs. You might want to eat more often, more energy, and actually, without even trying, might even lose weight. So I've talked to you a little bit about this, how I talk to my patients about nutrition. I start by asking, what do you eat? And then we start talking first about what to add into the diet. I don't tell people what to take out of their diet first. I talk about what to add in. And in most cases, most people need to eat more fruits and vegetables. So we talk about that. Talk about incorporating more vegetarian choices, that an ideal diet is going to be a whole food plant-based diet, but the closer that you can come to that, the better for your health. I try to avoid using the word vegan because I think it's a very polarizing word when we're talking about diet and nutrition. And finally, I'm going to close with this. This is a quote from Thomas Edison. "The doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition." If you want to learn more about plant-based diets and heart disease, how many of you seen the movie Forks Over Knives? Okay, a good portion of you. If you haven't seen it yet, I think it's a good view. If you've got Netflix, you can get it for free. I encourage my patients to start there by watching that film to kind of augment what I tell them. If you want a good book to read, Prevent and Reverse Heart Disease from Caldwell Esselstyn's a great book about plant-based diet and reversing heart disease and heart health. A couple of sites that I love, nutritionmd.com is from the Physicians Committee for Responsible Medicine, nutritionfacts.org. How many of you get Dr. Michael Greger's emails? Those are good. Dr. Michael Greger and his group, they come up with these videos that they put out talking about various topics about nutrition. He really reviews the literature. So what he talks about, it's very much based in science. It's not just emotion. It's not about animal rights. It's about science and nutrition. It's good stuff. And then finally, the Green Plate. This is a website I came upon recently. It's actually, I think, made by Mercy for Animals. And it's a great site for if you want to go vegan. It's got some great ideas, some great recipes there. And then finally, I want to encourage you to take a look at my book. As I said before, this is something that I spent 7 years working on. This is what I, as a cardiologist, want to convey to anybody who's concerned about their heart health. I really talk about, about exercise. I talk about diet. I talk about putting it all together. I've got some recipes in there as well. You can connect with me as well. I've got a website. I have an active Facebook and a Twitter account, and if you ever happen to be in Southern California and you want a cardiology consultation or a cardiologist to kind of look over your heart health, I'm around. So with that, I want to thank you all for being a wonderful audience.
Thank you all for coming tonight. Mahalo. Have a safe return home. Good night, everyone.